Let me thank the Pontifical Academy of Science and the Pontifical Academy of Social Sciences for hosting this landmark summit. And also let me thank Cardinal Turker and Jeremy for hosting this session on public health. So has been highlighted in many talks that we have heard this week, climate change is plausibly the greatest threat to population health that the world is going to experience this century. And so the central question of this session is how to promote health and protect health in the face of a changing climate. So to help inform and stimulate this discussion, David Bloom, who is here, and I have been asked to offer some remarks on the interplay between population health and climate change. So what we're going to do now, actually, we are going to build on what we have already heard this week, and especially on the excellent talks by Andrew Haynes over there, Gabrielle Dreyfus here, and also on the talk by Aruna Bhatt-Ghosh, who I don't think is here any longer. So my goal here now is basically to crystallize some of the ideas that we already heard and to frame them from an economic point of view. And I'm going to make two main points. So the first one is that to spur more urgent climate action, it is important to fully recognize and comprehensively measure and account for the health co-benefits of climate change mitigation. And the second point that I want to make is that there is growing evidence that population health promotes economic growth and well-being, much like education. And so this fact makes the case for urgent climate action even stronger. So it is now well understood that climate change impinges on population health in a multiplicity of ways. And we have heard a lot of testimonies and statistics this week, so I'm not really going to repeat. Here I'm just including a non-exhaustive list. So the health impacts of climate change are going to include increased risk of extreme severe weather events and related mortality morbidity. They include increased risk of infection by vector-borne diseases, contaminations of fresh water and disruptions of food supply, and mental health burden. I would also like to mention another health impact of climate change, which have given short shrift so far. Vanessa mentioned it a little bit just now, and it is the increased burden on already strained healthcare system and medical resources. So the combination of climate change-induced secular increases and episodic surges in the demand for healthcare will impede the ability of health systems to provide timely and quality care for a wide range of health issues and impose potentially crushing fiscal burdens. So just to give a very small and concrete example, when Hurricane Maria hit Puerto Rico in 2017, it inflicted severe damage on manufacturing plants that produce IV bags, sparking a shortage of those bags in the US. And so you had like a healthcare system impact of the extreme event. And then, of course, compounding all these challenges, disadvantaged populations because of either geographic location, pre-existing health status, access to health and economic resources are likely to bear the brunt of the health impacts of climate change. And such populations include people living in low-income countries and on small islands, children and older adults, ethnic minorities, queer communities, and migrants, as we have already heard this week. And notably and unfairly, these are also the populations that have contributed the least to the accumulation of greenhouse gas emissions. So to explain the lack of action, the classical economic framework sees climate change issue as a combination of two characteristics. First, climate change is a tragedy of the commons. So since the climate change effects of greenhouse gas emissions have no borders, we need the cooperation of all countries to solve it. But some countries may decide to wait for and free ride on the climate change mitigation efforts of other countries. Second, climate change is an intergenerational justice problem, with the burden of change and the cost filled on the current generation, while future generations reap the benefit. So basically, there is a temporal disconnection between who pays the cost and who enjoys the benefit. So this is like the classical framework to explain the climate change issue. And stressing the health benefits of climate change mitigation can, at least partially, address these two challenges, the tragedy of the commons and the intergenerational problem. So what are the co-benefits? The health co-benefits of climate change mitigation. So as already mentioned, the major sources of climate change coincide with some of the main drivers of poor population health. So as a consequence, when we slow the pace of climate change, we are also going to deliver substantial health co-benefits, independently of any future reduction in climate change. And here I have 3 examples of these health co-benefits. So first of all, the sectors that contribute the most to greenhouse gas emissions, like transportation and energy, are also the greatest sources of air pollution, increasing the risk of cardiovascular diseases, respiratory diseases, cancers, and dementia. And we heard on Wednesday that fossil fuel air pollution kills 5 million people per year. That means that transitioning to cleaner energy sources, incentivizing, for instance, the use of electric vehicles, is not only going to mitigate future climate impacts, but it's also going to improve the air quality and save numerous lives over the next few decades. Another example of health co-benefit of climate change mitigation is the impact on diet. So according to the Food and Agriculture Organization, meat and dairy production contribute roughly 15% of global greenhouse gas emissions. And the prevalence of red meat and processed meat-based diets are also a major risk factor for chronic non-communicable diseases, such as type 2 diabetes, coronary heart disease, and colorectal cancer. So especially in high-income countries, transitioning to a plant-based diet can actually reduce both greenhouse gas emissions and also the growing burden of non-communicable disease. And then the third example, urban planning focused on road transportation encourages a sedentary lifestyle and increases, again, the risk of non-communicable disease. But by contrast, urban planning that promotes safe walking, cycling, and the use of public transportation contributes to a healthier lifestyle and also mitigates climate change. And importantly, these health benefits will be experienced in the near term. They will be experienced locally, and they will be experienced most especially by disadvantaged populations, as those suffering the most from poor health are also those who suffer the most from the health impacts of climate change. So the last feature is adding to the moral imperative of addressing climate change. But the first 2 features, the near-term and the local nature of health benefits, imply that stressing the health benefits of climate change mitigation can actually encourage a more urgent climate response. And so why is that? First of all, because health benefits are near-term, it means that some of the benefits of climate action can be realized immediately, and all generations can gain from responsible climate policy. And so the narrative that the current generation is paying the cost and the future generation are reaping the benefits no longer applies. Anyone is going to benefit from aggressive climate policy. And there are a lot of literature on this result. Here I'm just going to mention one paper by some colleagues of mine that was published in Nature Communications. And so using an integrated climate economic model with an air pollution component, they report that a failure to acknowledge the near-term air quality health benefits results in a lenient climate policy. So basically, a climate policy that is not keeping the temperature increase below the 1.5 centigrade limit. And that policy has net cost for much of this sense. However, once we account for these health benefits of reducing air pollution, even a more stringent climate policy has immediate and continuous monetized net benefits, upwards of trillions of dollars annually worldwide. The second important characteristic of the health benefits is the fact that they tend to be local in nature. And so as a consequence, these health benefits do not suffer from the tragedy of the commons and the free riding incentive. Only the cities and the states that implement some form of mitigation can reap these health benefits. And so this implies that the health benefits may validate the possibility and potential efficacy for gathering local support for climate policy. So intuitively, by incentivizing the use of green energy sources, for example, in place of fossil fuels, local governments can improve air quality for their citizens, a local benefit, and at the same time provide climate benefits for the entire world. So our question is, can such a focus on population health drive actually more urgent climate policy? So we believe the answer is yes, but at the same time, we also believe that we need to strongly convey the message that investing in population health is good for the economy. And basically, the idea is that often the policymakers that hold the power of the purse, they care about the economy. And so if we show them that investing in health has also economic impacts and economic benefits, then they're going to be more likely to invest in health through mitigation policy. And this is basically what Arun Ghosh was hinting in his presentation when he talked about clean air being an economic asset. So let's, for instance, take the example of clean air. Clean air promotes health, but by improving population health, clean air also creates a sequela of economic benefits. And these benefits, for example, take the form of improvements in concentration and learning abilities, educational outcomes among children, which in turn lead to better labor market opportunities, higher wages, more human capital, and more economic growth. Clean air also increases labor force participation and labor productivity, and it reduces the healthcare cost of treating respiratory diseases and other chronic illnesses. And again, this is going to lead to lower fiscal pressure and more economic growth in the future. And the same can be said also for the other health benefits that I mentioned. So for example, encouraging healthy lifestyles and reducing the burden on non-communicable disease. These also are going to have sizable health implications that can be quantified. So health for many decades has been substantially and widely undervalued by economists. And the undervaluation is rooted in economists' failure to take on board the fact that health not only has intrinsic value, but also has instrumental value. So intrinsic value refers to the fact that actual and prospective states of good health are enjoyed for their own sake. By contrast, instrumental value refers to the fact that good health enhances our capacity to gain other things of value. For example, by improving our ability to work productively and earn income, to attend school and augment knowledge, skills, and productivity potential, and also maybe to look for after children and grandchildren and contribute to their well-being. And the bottom line here is that the benefits of climate change interventions will encompass gains in human health, as well as the social and economic gains that follow from these health gains. And accounting for all these sources of benefit is conceptually appropriate and technically feasible. It's going to magnify greatly the estimated returns of climate change interventions, and thereby it's going to strengthen the case for such interventions. It also puts emphasis on the economic value of investing in population health, and it allows the calculation of rates of return and benefit cost ratios, which is basically the natural language for ministers of finance, ministers of planning, and again, for any policymaker that hold the power of the purse. I would also note the possibility of calculating distributional sensitive rates of return and benefit cost ratios, which is a crucial ingredient in remediating some of the inequities of climate change impact. Okay, so just to conclude, the economic, health, environmental, and social costs of climate change are enormous. They're happening today, and not just in the long run. And so if I may borrow the words that Gabriele said yesterday, it's not just a marathon, it's a marathon and a sprint. And in particular, reducing greenhouse gas emissions is going to deliver important near-term and local health benefits. And stressing these health benefits promote economic growth and well-being. Stressing this economic implication provides a very strong argument for policymakers to invest in population health and thus contribute to the climate change fight. Thank you.